Today we are going to start about MCQs of the viewers regarding the aging. The first MCQs is the autopsy of 78-year-old man demonstrate decreased left ventricular cavity size and the sigmoid shear ventricular septum. Light microscopy shows increased collagen content within the ventricular wall. Some myocardial cells are having brownish perinuclear cytoplasmic nucleus. The changes described are most consistent in which of following condition: it is hypertrophic cardiomyopathy, ischemic heart disease, it's long-standing hypertension, normal aging. But if you remember about the aging portion of general pathology, you guys remember in cardiovascular system, in normal aging, they will increase the size of atrial cavity. Atrial cavity size increased and ventricular cavity size decreased. And they are having sigmoid shear ventricular septum. That all the things are related to normal aging and brownish perinuclear cytoplasmic nucleus lipofuscin. These all are characteristic of normal aging. If you guys guess, it's the age of 78-year-old. Okay. Whenever any MCQ, any question, there will be age of above 60 to 70. You should have to consider the normal aging persons also. This is a diagram regarding the young heart and the old heart. In the young, if you guys focus the normal here, this is the size of a cavity. This is the size of cavity of atrium. But here the size of cavity decreases. The ventricular cavity size decrease, but the atrial cavity size is increase. And also, if you guys see the size of septum, it is increased. Here it's very low, but there is a hypertrophy of the segment. And there is a dilated aortic root. And these are main concern and the main features of normal aging in cardiovascular. If you move to the next question, the next question is: a 78-year-old man dies to advanced esophageal cancer. The man's family donates his body for teaching purpose and autopsy is performed. Age is 78-year-old man. Gross examination for heart reveals left ventricular chamber size and wall thickening within normal limits. Non-significant atherosclerosis is seen in coronary arteries. On microscopic examination, myocardial cells demonstrate prominent yellow-brown intracytoplasmic granules. As shown in the exhibit, which of the following most likely account for observed microscopic changes? Guys, these are down. These are the brown. Correct? That is showing in this slide. It's a cardiac myocytes. If you calculate things, the cardiac cells, and they having that brown pigment, it's a nutrition. The lipofuscin is also one indication of aging. Yes. So what will be the answer? Right answer will be oxidation. Not exogenous pigment in the cytoplasm because it glucose no iron no. White cell glucose polymerase typically appear clear vacuoles. It's not the brown and yellow intracytoplasmic granule. It's clear vacuoles. If you talk about the iron gives the hemosiderin ligand macrophages in which iron containing brown pigment called hemosiderin, often seen in area localized iron overload that caused by the bleeding and tissue decompensatory heart failure, causes the leakage of edema and enterocyte into lung parenchyma, and hemosiderin ligand macrophages can be seen. But all the things are very normal. If you guys check the gross examination of heart, lungs, all the things are okay and fine, but There is a yellow color pigment intracytoplasmic ring that physiologically it is present due to itching and it is due to lipid peroxidation. So there's yellow-brown pigment contained within the intracytoplasmic granules. This is also the residual bodies. In this man, myocardium represents lipophilia and lipophilia in the composite lysosomal breakdown process. Lysosomal breakdown products. And second, it includes the lipid polymers and protein complex phospholipids that result from the free radical entry in lipid or oxidation. That are indicating lipid peroxidation and free radical entry. These are important points, and the insoluble granules are considered in the wear and tear proteins that accumulate with the age, and they are commonly seen in root nerves in like heart, liver, central nervous system of the adrenal glands. All the nerves. Okay. Now we have to move to our next question. Our next question is, you all graduated for the headaches that an encounter is. He takes no action and is lifelong non-smoker. The patient's blood pressure is 180/70 and a pulse 75 per minute and regular. During a pure office visit, blood pressure was 175/60. Physical examination shows S4 but is otherwise unremarkable. The CT scan of heart reveals no significant abnormalities. Which of the following age-related changes but best explain the patient blood pressure readings? First of all, this is not a conceivable thing because he having the age of 78 years old. In older people, the S4 is normal. Secondly, the most common thing due to aging, increasing atrial collagen deposition. In physiological aging, there is deposition of all collagen in the atrial wall due to the increase in blood pressure. We also have one table in which they all the mentioned physical cardiovascular changes. In aortic stiffening, the elastin is replacement with the collagen. Elastin going to replace it. Collagen, there is a pulse pressure increase due to isolated systolic hypertension. There is a mild concentric left ventricular hypertrophy that is response to cardiomyocytes, and they are having the resting AF, SV and cardiac output, and there is a maximum cardiac output will be decreased. Conduction cells and degradations. And we have a reduced in bioreceptor sensitivity and adrenergic responsiveness. He did not respond as a elder person, and the elder person not going to respond as much as a young person can respond. So it is very important point. In the older patient, there will be decrease in adrenergic responsiveness, reducing baroreceptor sensitivity. So there will be increase in aldosterase, decrease in heart rate and contractility responses. Okay. And the thing, the patient blood pressure reading show, if you again see him, this rating show a pattern of elevated blood pressure with a systolic. Systolic and diastolic in decreasing, and the pulse pressure consistent with isolated systolic hypertension. And isolated systolic hypertension is often seen in elderly patients that have an age more than 65 years old. And it is representing the 60 to 80% of hypertension cases in this population. And aging is associated with increased aortic stiffness caused by endothelial dysfunction and change in extracellular matrix composition. That is a replacement of elastin with collagen. You guys already know all the things. This is the main concern. What is isolating? Systolic hypertension. When the systolic blood pressure is high and the systolic pressure low, like here. Okay, This is an accelerated systolic hypertension that is common in elderly patients having the age more than 65 years old. Now we move on to our next question. Our question is, a 50-year-old woman who had a mild myopia for decades comes to the office with a routine physical examination. The patient had no chronic medical condition and eats a healthy diet consisting of a variety of organically grown foods. She's excited because she rarely has to wear glasses or contact anymore. Her visual acuity at week 20 is 20/13 both eye without wearing her glasses, which of following condition has physical etiology as the changes caused this patient visual improvement. Guys, in the main condition, they are saying that woman having myopia, but with the time the myopia is automatically spontaneously resolving. Why myopia is resolving and eyesight getting better, and the reason having same etiology with which of following factor. In that, if you guys check, the age is getting 50. It is moving toward aging. So the improvement mild myopia is likely due to the changes. And you guys already know age-related changes in skin wrinkles. But normally in accommodation and focusing on near objects, ciliary muscle contraction relaxes the zonal fibers allowing the lens to become more convinced so the image focuses on the retina. Also having one diagram, I will show you there. Yes, this is the myopia. In the myopia, the images focuses in front of retina. For the normal imaging, they have to focus on the retina, but in myopia, it's in front of retina. But in presbyopia, the images are focusing behind the retina. That is due to aging. It is due to aging and this disease is present that woman, but when both going to combine, like it is in front of retina, it is behind of retina. When both making a sum, it will can say its effect, it will can say its effect, and it will make a compensation. The myopia and presbyopia, they will make a compensation, and now images are going to focus on retina. Are you guys understand? Then in myopia, the image is going to show in front of retina, but it is opposite behind the retina. When we combine diseases, myopia and presbyopia, it will make compensation, and now image will focus on retina as it becomes better in that moment. I think now it is understand. But they are saying due to reason, which reason the eyes are getting better due to presbyopia, and this is due to aging. But in these all, which one is related to aging is skin wrinkles. The answer is skin wrinkles. Now we are moving to our next question. Our next question is, cell biologists is studying the role of ribonucleoprotein in normal function. To prepare a cell type of 3-year-old man, ribonucleoproteins are created and purified from the cell extract for structural and functional analysis. These cells are found to express higher amount of particular proteins in comparison to other cell types. This protein has reverse transcriptase activity that functions to add TTA-GG repeats to the 3 end of chromosome, which function cell type was most likely studied in these experiments. The TTA-GG is a code that is added by telomerase. And if you guys know about the telomerase, it is a ribonucleoprotein. The ribonucleoprotein that adds this code TTA-GG and repeats to the 3rd end of chromosome. Already mentioned that the whole thing, 3rd end of chromosome on the telomere region. It is free and similar to other reverse transcriptase enzyme in that is synthesize single-stranded DNA using single-stranded RNA as a template. Telomerase is composed of two main units, and the telomerase reverse transcriptase, and second is telomerase RNA component. Telomerase RNA component. These two are subunits of telomerase, and telomerase RNA components built in RNA template that is repeated by the TERT subunit to TTHG DNA sequence repeats. But in that they are asking, in some 3-year-old man, he takes two types of cells. And in one cell, you find they are red clones. They have a higher amount of particular proteins in comparison to other cell types. Why it's happening like that? These four cells and all the cells from same body, from same one being that having the age of 73-year-old, but one cell is providing more protein than the others. So what is happening? If you guys know the aging also depends on genetic. You guys remember? The both in genetic section they were facing genetic, and metabolism, recognition. Therefore, the three things on which the aging are going to depend. But in genetic, there is one thing: telomere. The telomere shortening is just happening by the cell is going to be divided. But in somatic cells and stem cell. In somatic cells like neurons, pancreatic beta cells, myocardial cells, all other cells short their telomeres. Okay. The most of them is differentiating adrenosomatic cells, myocardial cells, neuron, pancreatic beta cells have short telomeres, adenoid express telomeres, and the telomere shorten with every cell division. In every cell division, it will become shorter. So these cells provide less protein in the experiment. But the stem cells having a quality usage that comes an undifferentiated cell with the potential to differentiate into other cell types and can be classified as an embryonic or stem cell. In their senses, there is no shortening of telomere happening. So they having the long telomere. The somatic cells having short telomere with aging, but stem cells having long telomere if we compare with other cells. So in these all cells, the epidermal cells are stem cell, metallic cell, myocardial cell, neurons, all are somatic cells. So these all having short telomere. Yes. All having these all have short telomere, and the stem cell epidermal base is having long telomere. Therefore, it produces more protein than others. And this is the same sequence I already told you, TTHGG. Okay. And this is the enzyme telomerase, that is reverse transcriptase. Now we are moving to the next question. A 79-year-old man is brought to the hospital due to confusion for the past 2 days. The patient has nausea, decreased appetite, poor oral intake for several weeks. He has also mentioned that everything around him has the routine. He has no abdominal pain, medical history include long-standing heart failure, dual ejection fraction, and atrial fibrillation. Medication include metoprolol, digoxin, lisinopril, and apaxiphen. The patient is afebrile, blood pressure 130/80, pulse is frequent, abdomen is soft and tender, no rigidity, we found no massive pattern. Age-related changes in which of all effects is most likely cause for these patient symptoms. So if you guys know, intentional absorption will be decreased. Okay. Liver enzyme activity decrease, muscle mass decrease, plasma protein binding will be decreased, good liver function will be decreased, and immune clearance will also decrease. That's all the symptoms that is showing. It's a digoxin toxicity, and you guys know digoxin is going to eliminate from the body by the help of kidney. So due to renal clearance, these all symptoms are coming. If you guys know the thing manifestation digoxin toxicity, that life-threatening arrhythmias, in GIT there is an anorexia, nausea, vomiting, abdominal pain, anorexia, there is a perfusion, color alternation, like everything is shown yellow tint. The patient is complaining, he having weaknesses and fatigue. This is all about the digoxin toxicity, and due to renal clearance, and that the dose of digoxin must be reduced in all the patients. Now we are moving to the next question. A 3-year-old wrote office for a child business. Hemorrhage reports apart from an ear infection last year, it's a good health. The child started preschool this year. He plays with other children and often copies what they are doing, but does not play. Make-believe like his older sister. The patient knows his age, sex, can speak in 3-word sentence. He can ride a tricycle but can't hop on 1 foot. The patient can't use a spoon and fork enjoy eating with his hand. He scribbles spontaneously but can't copy a circle. Which of the following recommended milestone is like the this patient? Cognitive, fine, gross, language, and social. Guys, for all the things, you have to know in which category things are there. For example, the gross motors, the child to stand, crosses, take few steps, and he have to walk easily, climb off the chair, he have to run, kick ball, walk stair, he have to jump, he have to walk the stair with the alternating feet, and he have to ride a bicycle. He is 3-year-old boy, and he will ride the bicycle as they are mentioning in the question. So it is not the gross motor. Now we are moving to the next, that is the no. Say one word, say more than words, say two words, say more than words, say greater than 3 words, and sentence we simplify intelligible. In which he said that it's a well and a good health, and he is a preschool. And secondly, he can speak in 3-word sentences. As I mentioned, they are saying 3 or more than 3 words. So language is fine, translation of language. Now we are check the fine motor. Fine motor pencil grabs, stack 2 blocks, feed with finger, uses spoon. As you move close to pages, you have to trace his head and use fork and copy the circle. The same, he is a 3-year-old and his mom is complaining that he is unable to draw the circle, he is unable to use fork and spoon to eat the food. So on his fine motor. These all the things are included in the fine motor. And the cognitive, he knows that he play with other children. He knows and he play with other children, so he is in social activity and he good in cognitive. So until the fine motor. In age of 3, the baby had to enjoy the food and eat with his hand, with a spoon and a fork, and he have to copy a circle. Fine. Now we come to the next question. The next question is, a 63-year-old woman come to the office for a